Good evening. Confirmed cases of coronavirus in Tennessee just passed the 6,000 mark with 135 deaths.
And starting this weekend, it will be much easier to get access to a test. We are closely tracking these numbers as the state hopes to begin rebooting parts of the economy in about 2 weeks.
7 of the top 10 counties are right here in Middle Tennessee.
Today, in his afternoon briefing, Governor Lee announced that he is recommending all Tennessee schools stay closed for the remainder of the school year. All districts are expected to follow the recommendation, and some are already sending out announcements to students and parents. The state is also forming a task force to make sure that all kids are taken care of while out of school. The governor's announcement was expected, but it was his comments off camera that may raise some concern. News Channel 5 Chief Investigative Reporter Phil Williams has the exclusive recording. Phil?
All right, today in front of cameras, Lee said he still plans to begin reopening the state in May, adding, quote, "The most important thing is to make sure Tennesseans' lives are protected and safe." But in a call this morning with state lawmakers, the governor acknowledged a new surge in COVID-19 cases may be part of the price of his plan.
This virus is not going away. Just because we've mitigated it, we've done what we hoped for flattening a curve, we have learned how to control its spread. We can't live that way for months on end.
In his call with state lawmakers, Governor Bill Lee insisted that with COVID-19, Tennesseans will need to accept what he called the new normal.
It's going to mean people have to act differently when they go in public, and wearing masks and a greater use of hand sanitizers in public places, and retail or grocery stores where potentially aisles are one way and only limited numbers of people can go into business establishments like restaurants.
And while there's no longer an immediate need to convert the Music City Center into a makeshift hospital, Lee's team says their approach also means accepting that more people will likely get sick and preparing longer-term solutions just in case Tennessee's hospitals are overrun.
The idea is to have a location in place that can serve a capacity surge, until there's certainly a vaccine, but until this is more manageable and hospitals are feeling comfortable with respect to what they're able to do at their own site.
So instead of converting convention centers and dormitories into temporary hospitals, Lee's team told lawmakers they are scouting locations that could provide extra hospital capacity for up to a year and a half, which, by the way, is the estimated time it could take to develop a vaccine. Vicki?
Thanks so much, Phil.